We have a fabulous staff, starting with our nurse, Nancy Dole. Nancy volunteered to be part of this clinic and got a lot of training, became an expert. Also, Dr. Michelle Miller. Dr. Miller is a clinical pharmacist, and she also, again, volunteered to be part of our clinic, became an expert on the topic of hormones. We have a nursing assistant, Maria Luna. Maria is a very important, she is a native Mexican, so she can speak Spanish. We also have Claudia McKim. Claudia is not in clinic with us, but she does all the refills and calls and takes care of all the paperwork behind the scenes.
I think that it's really a wonderful honor to be voted on by our peers and to receive this recognition for our clinic. I think that it just furthermore goes to show the commitment that the University of Iowa has regarding diversity and regarding exceptional patient care for all of our patients.
We spend a long time not only getting trained ourselves, but training the staff. So from the front desk to the schedulers, people are trained on how to be inclusive and welcoming, and also having the right tools. But I think especially we have been incredibly lucky to receive training from the community themselves.
There's no specific training that a provider can necessarily have in terms of their medical knowledge, but Dr. Nisly and myself have done a lot of self-learning about the topic. We've gone to different national conferences. We have read everything that's out there and accessible to all other folks, but we've sort of made that a priority in our own practice. And then the other as important aspect is, of course, doing this cultural humility training for all of our staff, including the providers. And so we have done training through Safe Zone, through the Chief Diversity Office, and they were gracious enough to come and do training sessions for our schedulers and our front desk line, as well as our nurses and the pharmacists. And we made sure that pretty much everyone who has contact with our patients has gone through that training and has that knowledge. And that's really so important, just to know those different terms and definitions and how to really be welcoming by what you say to our patients that walk through our doors.
Any area can receive training to make your area more welcoming. It's a 2-hour program. People need those tools. We need tools from the front desk, from the schedulers. We need tools to be able to use language that is respectful, inclusive, knowledgeable, and welcoming.
I think that this is really an issue of wanting to provide the best patient care for a population that is known and that you personally see isn't receiving that.
What surprised me is how many people from so far away would be coming. And that tells me that if this is in Iowa City, this small place in Iowa, I can imagine how many people out there really need help.
The thing that surprised me as well have been just the numbers of patients that we've served. The majority of our patients that we see are transgender, so we do tend to kind of focus on them some, but I think that it's a really important and safe place as well for our lesbian patients, for our gay men, for folks who are bisexual, who are questioning, who are queer, women who are interested in getting pregnant. We've had men who are interested in raising families. We have men who feel like they just haven't found that safe space with their primary care provider, and they want to be able to talk openly and honestly and be able to have those competent providers on the other end who know exactly what they should be screened for, how to best counsel them. So I think that this really is a clinic that meets the need of the entire community, and we're really so happy to do such.
I'd like to add our immense thanks to our leadership for allowing this to happen, not only to allowing, but supporting very actively. It could never have happened without that. I also would like to thank the inspiration of the transgender and gender nonconforming community that not only inspired us, but helped us from the beginning. So that's my thanks to both groups that without them, we could not have helped to create this program.